Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Aye.
Chairman Meredith.
Aye. Motion carries. First item on the pulled list is with Eastern Kentucky University and is number 10 on the routine PSC green list. Your representatives here, please identify yourself for the record.
Thank you, Mr. Chairman. Ethan Witt, Assistant Vice President, Eastern Kentucky University. I'm also joined virtually by Dr. Sarah Ziegler, the Dean of the College of Letters, Arts, and Social Sciences.
Thank you much, Mr. Witt. Always a pleasure to have you appear for our committee. Not
Always-
sure you feel the
always
same
good to
way,
be
but
here.
always good to have you here. Senator Southworth has questions for you.
Could you just start by telling us a little bit about the search and how long it's been ongoing, what your plans are, and particularly how you chose this entity? Because I do see it's out of D.C., and I wonder if we have entities similarly situated that are perhaps from Kentucky.
Sure. I believe the contract date was for February 10th. Initial work has begun. No funds have been expended. And this particular contract is related to 3 dean vacancies we have. It will be to fill the dean of the College of Business. It'll be to fill the dean of the College of Letters, Arts, and Social Sciences. And it will be to begin laying the groundwork for an upcoming vacancy in the College of Justice, Safety, and Military Science. So the intention is that the Dean of College of Business and Dean of College of Letters, Arts, and Social Sciences will be filled by July 1. In terms of why it's not a Kentucky entity, this is a national search. My colleague, Dr. Ziegler, and others tell me that in the past, when we've handled in-house searches, especially for executive level roles like this, the results have not yielded what we want. This firm specializes in this work, whether it's knowing who the list of potential candidates are on a national scale, maybe with the College of Business, engaging with private sector partners in the business community, and doing all the things that go into those searches. This is the firm that we felt best had that expertise. Thank you.
Any other questions, comments? Motion to approve the contract. Is there a second?
Second.
Second by Representative Mentor. All those in favor of the motion will vote aye. All opposed will vote nay. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Representative Hart.
Yes.
Representative Mentor.
Yes, and good luck with your searches.
Representative Cook.
Aye.
Chairman Meredith.
Aye. Motion carries. Congratulations. You're welcome to stay with us as long as you would like. Yeah, you seem to be a little bit anxious to jump up from there, Mr. Witt, but thanks for coming this morning. Next item on the pulled list is with the Agricultural Development Board and is number 2 on the Personal Service Contract Amendment Ivory list. If representatives are here, please identify yourself for the record.
Good morning. My name is Brian Murphy. I'm the General Counsel for the Governor's Office of Agricultural Policy.
Good morning, Mr. Murphy. How are you doing?
I'm doing very well, sir. How are you?
Doing great. This will be a short conversation. I've requested this contract be pulled. Not that I haven't seen an issue with it, but it is a pretty substantial increase. Not that many dollars, but originally approved for $20,000. Now we're at $50,000, and I understand that these funds in part come from maybe some CARES funds, but just educate me a little bit as to why we're seeing this kind of increase and what these funds will be used for. Because it says provide funds to visit meat processing facilities and write reports and so forth. I would have thought that would already been in the initial ask, but we are seeing substantial increase. So what's precipitating that?
What the causes precipitating this are the unknowns. Our board has, for years been trying to stimulate agricultural growth in Kentucky. That's their mission. And so having a unusual year with COVID, one of the areas that they saw needed to be focused on in 2020 was meat processing. So through the course of the year, different steps were taken, but the board ultimately came to the conclusion that they needed an outside consultant to give them the best possible advice they could and how to best possibly invest their funds in these operations that wanted to improve. So through getting a contract with a meat processing consultant, we entered into it, and I probably didn't ask enough questions about how fast we were going to go, how many we anticipated needing to provide services for. And so not having been through the process before of getting a professional services contract, it was probably my mistake that I set the contract limit at $20,000.
Well, appreciate that, but I'm still a little lost on this. You have to excuse me. I'm a slow learner, but are we doing this in anticipation of growing that business, or are we doing it to supplement presently what we're doing with meat processing? Are we stepping up enforcement? So that's what I don't understand.
Well, the meat processors in Kentucky, smaller meat processors, regional meat processors, our board sees an opportunity to help them. And so they put together a program and allotted some of their funds out of the funds they already have allotted for the general state funds for stimulating agriculture in general in Kentucky. They now have decided to dedicate some of those funds to specifically helping meat processors improve their businesses. So the board, which we have, great agricultural experts on the board already, just saw a hole in their agricultural expertise that they needed another set of eyes and someone who's worked in the meat processing business for a while. And so that we decided to engage in a professional services contract with one that would come into Kentucky and go to the sites and give us a report on what's the best way that this individual meat processor can improve their business. And that way, when we give out the money to them, we can specify what the money is for.
So who will this consulting be reporting to?
He's reporting to our executive director and our deputy executive director.
And what's the timeline for this? I mean, you got December 31st, but is that the end of it, or do we look at extending this beyond this as we continue to provide assistance to these folks?
And the development board is, wanting to get the most bang out of the buck for their funds, and so the plan may change. But that is a possibility that we would entertain in the future once we see how things go through the course of the year.
So is the plan for the consultants to visit the current meat processors to identify their needs?
Yes.
Co-Chairman Cook has a question as well.
This isn't much a question as it is a comment. COVID highlighted a lot of different things throughout this Commonwealth. I think we all remember the shortage of toilet paper, and then we had the shortage of meat last year, and it absolutely drove the demand for homegrown local products, local meat. Meat processors right now are backed up over a year. So if you want to go get your own steer slaughtered right now, you're looking at a year out before you can absolutely possibly get this done. And I know this has been a big push from the Ag Development Board. I know Ryan Quarles talks about this often over the Department of Agriculture, and it's something very, very important for our farm communities, especially with the development of the small meat processors that are starting to pop up left and right. It's one of the good things. It's one of the good things that's come out of COVID is the development of these. So I think I actually appreciate what they're doing here and look forward to more of these mom and pop meat processing facilities being able to pop up and facilitate and help farmers around the state. Kentucky Proud Products.
I certainly agree with Co-Chairman Cook's position on this, and appreciate the information this morning. I have no other questions or question of committee members. If not, entertain a motion to approve.
Motion to approve.
Second.
Motion by Senator Southworth, seconded by Co-Chair Cook. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Aye.
Chairman Meredith.
Aye, motion carries. And Ms. Murphy, appreciate you being with us this morning and sharing some insight in this, and wish you the best of luck going forward.
Thank you very much.
Have a blessed day. Next
You
item
too.
on the pulled list is with behavioral health, development, and intellectual disabilities is number 2 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Hi, good morning. My name is Katie Marks, and I am the project director for the Kentucky Opioid Response Effort, and I have with me Nancy Hale. I'll allow her to introduce herself.
Good morning. I'm Nancy Hale, and I am President CEO of Operation Unite.
Good morning to both of you. I appreciate you being with us, and Co-Chairman Cook has questions.
Good morning, and thank you all for being on here with us this morning. So I'm only a few meetings into this, and I've seen Unite be on here every single time, and I am just actively trying to learn more about Unite and what's going on there, and hearing some of their success stories. I see a lot of money going that way, and I just wanted to hear from you all and hear a little bit. I'm trying to learn more about this. What's going on, because I foresee it looks like something that's must be on the agenda every month. So appreciate it.
And we appreciate that as well. Perhaps if I could give just a brief background on the partnership with Unite, and then I'll turn it over to Nancy to talk about some of the successes. So the Kentucky Opioid Response Effort has been partnering with Unite for several years now for the Kentucky Opioid Response Effort's treatment access program. And this is part of a large federal investment in reducing overdose deaths and increasing access to high quality evidence-based prevention, treatment, recovery. So one of our mandated services is to provide assistance to patients with treatment costs and to develop strategies to eliminate or reduce those costs. And we recognized, partially through the help of our partnership at ODCP, that Unite was a well-positioned partner for this work. They have a strong history of preventing substance use disorders, operating in the voucher space, and are a committed partner. And so we elected to utilize that resource and that talent to operate our treatment access program. And so what this looks like is across the state, licensed providers are enrolled into the program. And this is functionally designed by the department, but run by Operation Unite. And then when they have clients that have an opioid use disorder and don't have a payer source, so they're not yet enrolled in Medicaid, or they are on Medicare and can't pay for residential treatment, Unite reviews that client's application and then approves to use the state funds, the Kentucky Opioid Response Funds, to pay for residential treatment, intensive outpatient, or recovery housing. And so that's a brief background on what the program looks like, but I'll turn it over to Nancy to talk about some of the successes that they observed by running the program.
Thank you, Katie. Representative Cook, when you look at the success of the Kentucky Treatment Access Program, the core treatment access program, I think one of the things that we need to look at is the growth of the program. We were approached by the state to run the program, and as Katie said, our experience since 2005 with our own voucher program for residents in the 5th Congressional District, our extensive work with HHS, and of course with the Cabinet of Health and Family Services, looking at this particular program from February 2018 to February 2021, the treatment access programs, the stipends that have been approved in that time period, 4,760. And the stipends received for the same time period, 3,188. We have been able to treat the treatment access program recipients have come from 115 of the 120 counties in Kentucky. And so just that increase shows, part of the success of the program. The first year, to also look at the growth, the first year from February 2018 to January 2019, there were 786 applications. And then for the next year, we saw an increase of 20%, increasing to 942. And this past year, from February 2020 to January of 2021, there's been a 55% increase with 1,458. We now have 16 residential treatment providers participating in the core treatment access program. We have 83 facilities that are participating in the treatment access program, and the number of counties where those facilities are located across the Commonwealth, 42 counties. Our key partners in this, Addiction Recovery Care, Isaiah House, Edgewater, Volunteers of America, the Chrysalis House, StepWorks, Transitions, and there are 8 community mental health centers participating.
A follow-up question, if I may. Notice on the money here, it's 100% federal. Is that is all the funding federal?
Yes, 100% is federal.
That's all I have.
Excuse
Mr.
me,
Chair,
any
I have a question. Mr.
Yes.
Chair, Senator David Yates, if I may.
Yes, Senator Yates, please proceed.
Thank you, Mr. Chair. First of all, thank you for being here. Addiction has been just a plague on society for some time, and now we deal a little bit with the dual diagnosis, realizing how hard that is when you're dealing with addiction and mental health issues at the same time, and so many there with a lack of insurance ability to do that. It becomes a major crime problem, underlying crime, and police don't know what to do with that until it's just repetitive in and out of our jail system. And recently, we lost a beautiful young lady in my district to an individual who was a heroin addict, repeatedly a user and abuser in and out of the criminal justice system. And I know we have different approaches the way we handle that, but in Louisville, I know that there's more people who are asking for treatment and ability than we have beds available. And so the question was asked, this is all federal money, quite a bit of federal money. And you said that there's the need continues to, or the amount of beds provided, the amount of help provided continues to increase. My personal experience into it is we still are so far off from being able to provide enough help for those who are asking for it. And then sometimes because of this enormous amount of cost, we're doing 30 and 60-day treatment and release, kind of catch and release, which means the recidivism rate is going to be through the roof. When we look at places like the Healing Place and other partners that you guys have had, when they have higher success rates, it's because the treatment's much longer. Has there been any kind of work with the Commonwealth of Kentucky to kind of have skin in the game on this as well, to expand that? Right now, we're doing a pass through some federal grant money, but because we have been just crippled by the addiction issue, is there additional ask in our budget to expand that, to make it more readily available, to increase treatment time, and hopefully actually get a catch on some of the addiction issues?
Yeah, I appreciate that question and agree that the need to continue to expand capacity to serve is undeniable, and across the full continuum of care. So residential, outpatient, every level of care, so that we can help retain them as they transition through. The CORE project operates within the Department for Behavioral Health, and so we are integrally invested in the work that our Department for Behavioral Health is doing, our Cabinet for Health and Family Services and doing, and coordinate all of those, the resources and asks to our Commonwealth in terms of state dollars versus federal dollars. And so I can't speak to what recent requests have come through or our budget status. I know I have Stephanie Craycraft, who is our Deputy Commissioner and oversees finance. She might want to comment here, but I do know that it is an investment that is long-term and will need to continue to grow.
Senator Yates, any follow-up on that?
No, Mr. Chair, I know this is for a long discussion, and I know it's something that is a deep concern for all of us, each one of our districts. And so I appreciate the good work, and I think having just the constant look at best practices is so important. So I appreciate that. Thank you. Thank you, Mr. Chair.
Thank you for your comments. Thank you for your question. Any other questions? If not, do we have a motion to consider the contract review without objection?
I'm sorry, I've got some comments. Adam Bowling of Bell County.
Yes, Representative Bowling, please proceed.
Sorry about that. I commented in the chat, but anyway, I just want to say I've seen the good work that that has come out of this program. I know people personally that have been able to extend their stays in treatment from 30 days or 60 days to add another 30 or 60 days because of these stipend programs, and because of the good results they've gotten, because they've been able to stay in treatment longer and really address the fundamental issues that got them into the situation they're in. So I appreciate this program, the good work that the people at Unite are doing and the cabinet are doing. So thank you all.
Thank you, Representative Bowling. Anyone else? If not, again, do we have a motion to consider the contract review without objection?
Second.
Motion by Representative Cook, seconded by Representative Mentor. All those in favor vote aye. All opposed will vote no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Aye.
Chairman Meredith.
Aye. Motion carries. And thank you both for testifying this morning and answering our questions. Very insightful. Appreciate it greatly. Next item on the pulled list are the Department of Community-Based Services and our numbers 23 and 24 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
I'm Jason Dunn. I'm the Director of the Division of Family Support in the Cabinet for Health and Family Services.
Mr. Dunn, appreciate you joining this morning. Senator Southworth has questions for you.
Okay.
Thank you. So I'm looking at a number of these, and they're just going through. I just picked out just what I'm looking at here. On number 23, says it's federally funded 56.18%, and general is 43.82%, whereas 24 and all the others are 100% federal. And I wanted to find out what those general funds are, and why that one is different.
There's actually three agencies that have some state funding put in them, and I discovered that mistake while I was waiting to talk here today. The Harlan County Community Action Agency also has a little bit of state funding. And then there's one other that I don't believe is on this list yet. It may be on the next month's list. The Multi-Purpose Community Action Agency also has some state funding. This is a federal block grant that we receive. It's allocated amongst the 23 community action agencies with a formula that was set before any of us were around. I've tried to research how long that formula has been in place. It's been in place quite a long time. I think it predates all of us here. But a funding formula is good, but it also shows sometimes that there's some places where the formula doesn't meet the need. And I believe that's what has happened with these three agencies. The amount of state funding has been constant for many years, at least 15 that we could go back, and probably longer than that. Other than a couple of years where there were some mandated percentage cuts. So I think these state funds were added to these three agencies just to kind of support and supplement what little bit of federal money they were getting because of that funding formula. So that's our that's what we understand is the reason for the state funding that's added to these.
Thank you.
Mm-hmm. You're welcome.
Any other questions or comments? If not, do we have a motion to consider this contract review without objection? Motion by Co-Chair Cook, seconded by Representative Hart. All those in favor of the motion will vote aye. All opposed, no. Clerk, please call the roll.
Senator Hornback. Senator Southworth.
Aye.
Representative Hart.
Yes.
Representative Mentor.
Yes.
Representative Cook.
Aye.
Chairman Meredith.
Aye, motion carries. Mr. Dunn, appreciate you being available to us this morning, answering our questions. And
happy to. Thank you.
Next item on the pool list with the Finance Office of Secretary is number Excuse me. Just need clarification that that motion covers items number 23 and 24 on the list. So, thank you. Again, the next item on the pulled list is with Finance, Office of Secretary, and is number 39 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Good morning, Mr. Chair. This is Brian Thomas, General Counsel, Finance and Administration Cabinet. Also with me is Wendy Smith. I'll let Wendy introduce herself.
Good morning. Thank you. I'm Wendy Smith. I am Deputy Executive Director of Housing Programs at Kentucky Housing Corporation.
Thank you. Appreciate both of you being available to us this morning. And just note to our members that you have a letter from the Finance Cabinet that's attached to the pool list regarding this item. But with that, Co-Chair Cook has questions regarding this item.
Good morning, Mr. Thomas. Good morning, Ms. Smith. Thank you for being here. I just start off with $264,500,000. It's a lot of money to go through without talking about it. And perhaps if you could give us an explanation on that. Who's getting the money? How are we tracking it? How are we administering? Just a lot of money getting thrown around here. Thank you.
I'll take that up first and then pass it off to Wendy. So this is a MOA between Finance, Kentucky Housing Corporation, and PPC to administer the Treasury's Emergency Rental Relief Assistance Program. We are doing that through the Healthy at Home Eviction Relief Program. And so that prior program was again, a multi-agency effort between, Finance, Housing, and PPC, and we're administering this in the same way. I'll let Wendy address the particular program details.
Sure, thank you. And to give you all a little bit of background that Brian alluded to, in the fall, through some CARES Act dollars, we began the Healthy at Home Eviction Relief Program to help get landlords paid for back rent and to keep folks who've lost income during the pandemic or had some other economic hardship, keep them housed and keep evictions out of our courts. So we began that in the fall, and with different funds than this, using the application, online application that PPC built for us. During that time, we got $14.6 million out to over 4,100 Kentucky households, all renter households. That was across 119 counties. Louisville got its own direct allocation of CARES funds, so they ran their own program. As Brian said, Treasury, through the second COVID relief legislation, created a program that Treasury calls Emergency Rental Assistance. And that got approved December 27th through legislation. The funds flowed to the Finance Cabinet, or to the Commonwealth, from Treasury in late January. We began planning actually in early January, so just a couple weeks after the legislation passed, for how to utilize our existing application process and staff and infrastructure to continue to get rent and now utility assistance. That is new. We didn't have assistance with utility before. And so what the program allows us to do is to get landlords through a direct deposit 100% of rental arrears and 3 months of future rent to make the landlords whole, to get the tenants current and keep them stably housed. And again, keep eviction cases out of the courts once the CDC eviction moratorium lifts. We already have, we opened on February 15th, the application. We now have, so in less than a month, we have 7,500 renter households who have applied and 4,900 landlords. We have to get information from both parties, so we do require applications from both. That gives you a picture of the volume of need or demand for the assistance. And in terms of applications that we are currently ready to process, it's 5,300 applications. That just gives you a sense of kind of the volume that we saw in just a few weeks. The current requested rent and utility assistance combined is $15.6 million right now, just a few weeks in.
So what about if there's a case where the tenant has already been evicted? I mean, is the landlord allowed to get back pay on that? How does that work?
The program does not make an allowance for that. And we have had a number of landlords through our first fall round and this round contact us about just that challenge, where someone already moved out or has already been evicted, but there were significant arrears owed to that landlord. And just within the structure of those programs, because it is intended to keep people housed, that is not an option for us to offer a payout in the event that someone has been evicted or has left voluntarily.
And just for clarity, the eligibility requirements were set by the federal statute.
Yes. Yeah.
Okay.
Mr. Chair, may I ask a question?
Well, certainly. Please proceed.
Thank you, Mr. Chair. I know that we've probably, all the senators have gotten questions and issues, and my answer right now is I don't know. But one was that a lot of landlords for a long period of time, sometimes 6 months or so, they just went without payment. And now when people are going back to work, they've kind of started off making those payments again. So now there'll be a 6 month gap in back pay. They're still in the house. They're making monthly payments now. Will this program be able to get the renter back whole and the landlord in that situation?
Yes, that's exactly, I mean, it's for any kind of need case, but that's really what it's aimed at. So the way it's structured by legislation that passed December 27th is we can go back to April 1st of 2020 to pay arrears. We can cover up to 12 months of arrears. So maybe they paid a couple months, they missed a couple months, or they made partial payments. We can make up the difference. And then we're allowed to pay 3 months of future rent to keep them stable and kind of give folks, renters and landlords, some stability to hopefully be able to take on the payments themselves in the future.
And can you tell us where I'm sure anybody, all 10 people are watching right now, but could you tell us where that they could find this information and throughout?
Absolutely. So your best bet is to Google Healthy at Home Eviction Relief Fund, but the website is teamkyhherf.ky.gov. And that's got a ton of program details, the income limits. It's pretty roomy in terms of the incomes we can serve. We can go up to 80% of area median income. We're an organization that usually deals with deeper income targeting for housing assistance. So we can help with a pretty broad swath of households.
Okay.
One more question, Mr. Chair.
Please proceed.
Would on these applications, do we see the tenant and the landlord applying together and working together to get that, or is it usually is the tenant applying, is the landlord applying? How does that work? And is it a stronger case if they apply together?
It's all of the above. We see a little bit of everything. The way the system that PPC Built Us works is we do require that each party has the other's email. We have to have documentation from both parties per the legislation. There's just some things we have to gather from each. So if the landlord applies first, then their tenant is sent an email that says, your landlord has completed their application, you need to get yours in. Or the reverse happens. If the tenant goes in first, then the landlord gets an email saying, please complete this. We do also, if we don't hear from the landlord fairly promptly or the tenant, we reach out and call them if the other party gave us a phone number so we can try to get them to go ahead and get their documentation in. To prevent fraud, we've got to have some elements of documentation from each party.
And I can't imagine either party, once that process is started, I would imagine that either party would be quick to jump on it. The tenant wants to get that covered, the landlord wants to get his or her money. So has there been any trouble with one party completely balking on this, or has it been smooth sailing?
It happens, but I will say it is rare, particularly in our fall program, because we did not have the amount of funding that we now have. I mean, we are in the position of actually believing that we may be able to help every eligible household that's able to get us a complete application. We're not usually in that position with a program like this. So in the fall, we required landlords to forgive 10%, to write off 10% of the arrears. That's not the case now. It's 100% of arrears. And so we're hoping that helps us get over the hump of some landlords being reluctant to participate. the one issue is that some landlords are they've reached a breaking point and they just want to evict. And if that's their intention, they're disinclined to participate because we do require that they don't evict the tenant for a period of time. For at least 45 days after we've given our funding, they've got to commit to not evicting.
Thank you all very much.
Any other questions, comments? If not, do we have a motion to consider the contract review without objection?
Motion.
Motion by Senator Southworth. Is there a second?
Second.
Second by Representative Mentor. All those in favor of the motion vote aye. All opposed will vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Aye.
Chairman Meredith.
Aye. Motion carries. Mr. Thomas, Ms. Smith, appreciate you joining us this morning. Appreciate the information. Thought it was a great discussion and great education for us.
Thank you.
Thank you.
Next item on the pool list is with the Public Protection Office of Secretary and is number 41 on the routine MOA pink list. If representatives are here, please identify yourself for the record.
Tammy Branham.
Good morning. My name is Tammy Branham. I'm the Deputy Executive Director for the Office of Administrative Services in the Public Protection Cabinet.
Thank you. Appreciate you joining us this morning. Co-Chair Cook has questions regarding number 41.
Good morning, Ms. Branham. We got $850,000 contract here, and very, very vague on the explanation that I have in front of me, and just curious if you could give us a breakdown of what is happening with this $850,000, please.
Yes, sir. The initial contract that was set up to disperse funds from the Team Kentucky Fund expired as it was governed by the executive order, which expired on February 6th. We still had a balance in the Team Kentucky Fund, and in order to continue disbursement of vouchers, we established this second contract for the $850,000. I think it needs to be made clear that this was in no way a payment to Community Action Kentucky. It was merely a pass-through contract dispersed to them in a lump sum to finalize outstanding vouchers.
So what were the vouchers? Can you explain that part of it to me, please?
Yes, sir. Included in the contract, it was allowed that a household receive a maximum of $1,000 in vouchers. This could not exceed monthly expenses. So if for 1 month you had expenses that you could prove that qualified for only $900, that was the maximum that you could receive. What qualified for these vouchers were rent, mortgages, food or grocery, and utilities. And there was no limit outside of the 1 month parameter except for food and groceries, and that was $100 per household member.
And one more follow-up. What about how are the payouts going? What percentage of our unemployed Kentuckians actually receive this? Did 100% receive this, or where is that?
Well, if I understand the question correctly, we had over 4,000 applications received. There were some outstanding applications once the funds were exhausted. We paid out a total of $3,768,530 to both individuals and charities. If that answers your question, sir.
It does. I'm just trying to fill the gap here. So we had 4,000 applications.
Approximately, yes, just over 4,000.
What was our total unemployment at our max? You wouldn't happen to know that, would you?
No, sir, I apologize. I would not, but I could look into that for you.
Okay. I'm curious. I'm trying to see what our percentage of unemployment was versus the percent that actually applied for this fund, and then how that was paid out is kind of where I was going with that. But thank you.
Yes, sir.
Any other questions, comments? Senator Southworth.
Yes, you mentioned that the executive order expired February 6th and we had excess funds we needed to put through. So does this complete the funds, or is this an ongoing thing that there's going to be more funds coming in and we're going to be?
No, ma'am. The acceptance of donations has ceased, and the second contract allows for no extensions. The current contract expires May 1st. 2021, but there was a small balance left in the fund after the donation ceased and after the deadline passed. And in those funds, it's a balance of about $9,100 will be refunded to the entities who donated that money.
Okay.
So effectively, this program has come to a halt.
Okay, thank you.
Yes, ma'am.
Any other questions, comments? If not, I will entertain a motion to consider the contract review without objection.
So moved.
Motion by Representative Hart. Is there a second?
Second.
Seconded by Representative Mentor. All those in favor of the motion vote aye. All opposed will vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Aye.
Chairman Meredith.
Aye. Motion carries. And appreciate you being here with us this morning and giving us insight into this.
Thank you, sir.
Final item on the agenda is an exemption request. This came from the Justice and Public Safety Cabinet, Department of Corrections, and it's a request and exemption from Committee Policy Statement 99-4, which prohibits contracts and agreements from extending beyond the biennium for a comprehensive medical services contract for the inmate population. The initial term for this contract will expire June 30th, 2024, with two optional 2-year renewals, and it's 100% general funds. And our representatives from the Department of Corrections or Justice and Safety Cabinet, are you here today?
Yes, Hillary Daly, Deputy Commissioner of Support Services for the Department of Corrections.
You flying solo today, Ms. Daly?
Yes, sir.
All right, thank you. If I could, let me give our committee members a little background on this, because with the exception of Representative Hart, no one else was involved in this decision last year. And this came to us last July to ask for an exemption at that time. But to go back a little bit further in history, last spring, Representative Nemes, in his capacity as chairman of the Budget Subcommittee who oversees the Justice Cabinet, raised some serious concerns about the RRP which had been distributed for this particular contract. And bear in mind, this is a $750 million contract. And his concerns, and I'll try to abbreviate this as much as possible, but the turnaround time for that RFP was only 21 days, which is 15 working days. And bear in mind, $750 million contract. And there was no pre-proposal conference that was offered to prospective bidders. And according to the timeline, responses to questions from vendors, they only had 1 week, 5 working days to submit those responses, and really not enough time to analyze those and integrate the data in the response. The RFP also contained no data on pharmacy and dental components, and bear in mind this is just not medical, but it is pharmacy, mental health, and dental. And the resulting contract would have a 10-year term, which seems extraordinarily long in any measure. And he finishes by saying that it appeared that the incumbent vendor had a significant competitive advantage not accessible to the other healthcare providers. And this would not only lead to major competitive vendors deciding against the main proposal, but much worse, it was artificially inflate the cost of the contract. And as a result of his work and the work of his committee, that RFP was withdrawn, and they kind of went back to square one. During that testimony for the committee, Secretary Noble was in attendance, and she agreed that the RFP really was not supportable. And I'm quoting from her statements here, that there really wasn't a lot of trust in the process, and it was totally unsupported. It was not a proper RFP, and her commitment to a 100% good and open process. And she also expressed concerns about the 10-year term. As a follow-up to that, in November, another committee meeting, Representative Nemes mentioned again his concern about the RFP and its development and asked for more legislative involvement. But some things he had asked for in the upcoming RFP was that the Justice Cabinet and Department of Corrections would meet with qualified companies in the correctional healthcare industry prior to RFP release. So I guess that's the first question, Ms. Daly. Did that occur?
We really felt it was improper to meet with potential vendors prior to the RFP being released. We believe in the integrity of the procurement process, and the RFP process is the opportunity for vendors to put their best foot forward. And, we did have a vendors conference or a virtual tour to which all the vendors were invited.
Another request that Representative Nemes had was in designing the RFP schedule that sufficient time would be allowed for the proposers to ask questions, receive answers. And it was his understanding that a 90 to 180-day time frame is customary.
The RFP closes on March 22nd. It has been out for more than 60 days. There have been 2 rounds of vendor questions, which was not afforded in the previous RFP that was withdrawn.
He also requested a mandatory pre-bid meeting should be held after the RFP release, with scheduled site visits to every facility. And I'm sorry, go ahead.
I apologize. I didn't mean to interrupt. We did the virtual site visit with our 2 primary medical facilities. That's the Kentucky State Reformatory and the Kentucky Correctional Institution for Women. When these services were bid out over 7 years ago, those were the 2 facilities that were used for in-person tours.
Representative Nemes also requested that those vendors should have had adequate data of pharmacy utilization expenditures, hospitalization utilization expenditures, specialty care utilization expenditure, and current detailed staffing levels at each facility. Were they provided with this information?
Yes, that is my understanding. We had a lot of very detailed attachments to this RFP, I believe over 20 attachments. And if the data that is needed by the vendors they felt was not provided, that they had that opportunity to ask for it during the 2 rounds of questions.
He also expressed concern about the cost and pricing in terms of the scoring. Who will score these proposals?
It will be a committee of Department of Corrections staff, Finance and Administration staff, and possibly Justice and Public Safety cabinet staff. I don't believe they've determined the full evaluation team at this time.
And what will the scoring criteria be?
I don't have that in front of me. It's very thorough. There's a cost proposal and a technical proposal. I can get a copy of that RFP to the committee if you all would like to see it.
I'm curious as to how those scoring components are weighted. Is there any particular one that carries significantly more weight than others?
I believe the technical proposal is the most heavily weighted.
And what does that encompass when you say technical?
It's a very robust and lengthy RFP. I apologize for not having pulled that in front of me, but I will, be sure that is sent over to the committee, and please feel free to ask us follow-up questions.
Well, I'll go back to Secretary Noble's comments last spring to the committee, where he committed to 100% good and open processes. And even though we've extended the timeline a little bit for this from 21 working days to 35 working days for a $750 million contract, this seems like it's still a very, very short time frame. And I think it was his expectation that when the RFP was being developed, that there'd be some legislative review of that, and obviously that did not occur as well. I am pleased that we've reduced the timeline from 10 years to 7 years, but that still seems to be excessive to me. But I really don't see how you're going to get credible responses to this on such a short time frame that these vendors have to put this together. Again, this is a $100 million contract, so there's great potential for profit here, but there's also a great potential for loss, for risk if you're not fully informed of what this all entails. And again, I just share Representative Nemeth's concern that this is too abbreviated in the process, and why could we not give a longer time frame for this, and especially given that he brought these concerns up last June.
Well, we would like to have this awarded for the onset of the next fiscal year. I believe is one of the most primary concerns. We've extended our existing medical contracts several times, but I believe with the committee support, we're open to looking at our options on the length of how long the RFP is issued.
Well, I hope I'm not the only one that has this concern, but again, it's a sizable contract, and I guess I'm a little bit disturbed that we had this discussion last spring. Representative Neiman, I think, just did an admirable job of outlining what the concerns are and what we should consider going forward. After we gave the exemption, approved the exemption request last year, that why we didn't almost start immediately on developing RFP rather than wait till November to put this thing together and not get it out to the prospective bidders until January 15th.
The department spent quite a bit of time from between meetings when we withdrew it the first time. We had a lot to consider in adding pandemic response requirements to the RFP. It took a lot of time to develop and make sure that this was the best RFP that the department could issue. I understand the time concerns.
Well, to summarize my concerns is I don't think you're going to get a fair and representative response to the RFP. I could be wrong, but I think we're setting ourselves up for failure here. There are other companies that can do this work and should be given serious consideration, but I don't know how they respond to this voluminous proposal in such a short time frame. So would consideration be given to extend it at least another 30, 45 days?
I will consult with the Justice Cabinet on that request. Absolutely.
Senator Southworth.
Thank you, Mr. Chairman. I have a few questions.
Fire away.
You mentioned, I think that you said there were 2 companies that have responded to the RFP. Is that correct?
No, the solicitation is still out and does not close till March 22nd, so we do not know yet who will respond.
Okay, so we don't know it in this space. I mean, obviously, corrections, medical services can be or cannot be maybe, but kind of a specialized thing. Maybe not everybody's in it. Do you have an idea of the universe of possible vendors and the number of that? How many might be eligible even to put in for the RFP?
I don't have an exact number. I mean, I'm aware of at least 4 to 5 companies who are in this field who specialize in correctional health care.
And you said 7 years or 10 whatever years ago that we last did this. How many put in at that time? Was it all 4 or 5? That's how you know about them, or you know about them the other ways and there are only 1 or 2?
I wasn't involved with that procurement, so I can't speak with certainty, but I believe at least 4 bids were received. I can confirm and get that information back to you.
Okay, so if March 22nd is coming up soon, if March 22nd comes and goes and we have 4 or 5 bids, we can safely assume we've probably covered the gamut?
Yes, we would hope so. I'm sure possibly there have been other vendors that have come on to the horizon since the last time this was procured.
Now, I'm going to need some assistance with timeframes here to get from March 22nd moving forward to getting things ready for July 1. Mr. Chairman, maybe you know better than I do, but is there, and he just asked for an extension of time, is there, come March 22nd, is there going to be space to add 30 days to still get this going, or we definitely need to do a whole year extension, or Like, what does that look like?
In order to evaluate this properly, especially a procurement of this magnitude, we would probably have to ask for to extend our current medical agreements in front of the committee.
One more question, Mr. Chairman. The costs for the current medical agreements, I know we're talking about $750 million, but I think that was maybe the number for the 10-year, or I'm not really sure, but I'm just basic math here, number of years, total cost. What are we looking at right now for our total cost, and how does that compare to this 750 and or whatever else we think we're going to get?
Yes, the $750 million would be an estimate for a 10-year agreement. This proposal is for a 7-year agreement. The annual cost of our current medical agreements is right at $88 million.
Okay, Mr. Chairman, one more. That was the last one, but it's not my last one now. So if we have $750 million for a 10-year agreement, are you saying that there's some kind of cost savings buying in bulk per se versus $88 million for a one-off year, or what does that look like?
We definitely hope so. Of course, we have no idea what the bids are going to come in, and our most volatile pricing contract, of course, is pharmacy, and that's because manufacturer pricing changes, the needs of the inmates change. I included what we have in the contract cap in pharmacy, which may be hopefully more than we need to spend, which drives that number heavily.
Okay, thank you, Mr. Chairman.
Co-Chairman Cook, you have a question?
Yes, sir. Good morning. Thank you for being on here. My question is about the virtual tour, and I understand in the world of COVID, it's tough to actually do that, but this is an extremely long contract for an extremely large amount of money. How could you properly portray what was going to go on with, I don't know what did those virtual tours consist of? How did they do that? Is there any possible way that we can actually get those people to do the actual tour? Just had some concerns about that, and then I'll have one follow-up.
Right. Like I said, the videos were very in-depth as far as how KCIW and KSR are set up, most especially the medical units and the medical facilities. In order to do an in-person tour, I definitely have to consult with our commissioner and the cabinet. We have, very large concerns about having people within our prisons. That includes central office staff. I haven't been in a prison since COVID started for that very reason. We have we want to protect our population at all costs. So again, I would have to have longer conversations with our executive staff and cabinet staff.
I understand that. It just seems like for this amount that, possibly COVID tests could have been performed and some kind of process on that. Is there a bidder packet? And if so, how many firms have requested the bidder packets and then actually participated in those virtual meetings? I'm just curious, back to Senator Southworth's question and kind of going there. So how many firms actually participated in those virtual tours?
I will have to acquire that information, and I will be happy to get that and send that over to the committee.
Thank you.
Senator Southworth, you have a follow-up?
Yeah, one follow-up on time frame. We talked about getting the RFP. You didn't have it in front of you. We're talking about it today. And then also the company numbers. Is that something that you have like on your computer we can find within 10 minutes or like by the end of today, or we need to talk to somebody else by tomorrow, or when are we going to be able to get that?
I would imagine at the latest I can have all the information requested by you all by tomorrow morning.
Okay. Thank you.
You're welcome.
Mr. Chairman, I think extending the period for the contract review is appropriate to ensure that it's a fair process. But I'm just kind of a loss of what if they're going to get us information tomorrow. What's our next step? As far as what would be the prudent way to proceed?
Good question, Representative Harton. What I'd suggest is deferring action on this exemption request till next month so that we can have this additional information and try to get a firmer commitment on extending this response time. I understand the challenges that everybody's having with the pandemic, but even more reason to give these prospective vendors more time to look at this, because they can't give you an effective proposal if they can't go into the facilities. And we know that's still not acceptable given the current circumstances, but I think we should extend this some additional time to ask more in-depth questions, get more information, whatever they need. And that's a request I would make of the cabinet, is extend this, consider extended from the 30 to 45 days. My preference would be 45 days, but if not, in the minimum 30 days. And, if we need to extend the current contract, then the governor can certainly do that under executive order. But I think it's too important for the people of Kentucky. Again, $750 million contract. If there's a 10% savings here, it's substantial that we can use in other places. So that's the request I would make of the cabinet.
Mm-hmm. And Mr. Chairman, if it's appropriate, I would make a motion to defer this until we get all the information.
It is most certainly appropriate. Motion and a second to defer action on the exemption request. Any discussion on the motion? If not, clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Aye.
Chairman Meredith.
Aye. Motion carries. I'd also entertain a request that we make a formal request of the cabinet and Department of Corrections to extend this for another 30 to 45 days. Representative Hart, seconded by co-chair Cook. All those in favor of the motion vote aye. All opposed vote no. Clerk, please call the roll.
Senator Hornback, Senator Southworth,
Aye.
Representative Hart,
Yes.
Representative Mentor,
Yes.
Representative Cook,
Aye.
Chairman Meredith.
Aye. Motion carries. And Ms. Daly, I know these are really challenging times for everyone, and we're not trying to make life difficult for you or anyone within the cabinet, Department of Corrections, but we do have a fiduciary responsibility to the people of Kentucky, and we need to make sure that we're spending our dollars as effectively as we possibly can. So I sincerely appreciate you being with us this morning, and respectfully request that you all give serious consideration extending this timeline.
Thank you, sir.
Thank you. For adjournment, our April meeting is scheduled for Tuesday, April 13th, 9 o'clock a.m. Is there any other business come before this committee? If not, we stand adjourned. Thank you.